Hey everyone, welcome back to The Political Patient. I'm Shreyas and I'm here with Anusha. Today we're going to talk about Omicron and specifically how it's been impacting travel. And we're going to focus on like flights in particular. And we know that a lot of people are traveling now because of the holidays, and we definitely wanted to talk about that. Before that, we want to mention that Omicron is hitting the world in very different ways. We know that it was discovered in South Africa, and thankfully, the country is doing a little bit better with Omicron right now. And we know that various countries are implementing different measures with Omicron. Like, if I'm not mistaken, the Netherlands basically has a lockdown going on right now, where Italy and France are a little bit more relaxed about it, with some restrictions on how to gather for Christmas or New Year's and things like that. But with that, obviously, a lot of people have been traveling to countries, with especially with to countries that have more relaxed restrictions, and traveling involves airplanes. And something big that's been going on is that a lot of flights have been either severely delayed or canceled because of the variant. In terms of cancellations, it's because of either airplane like capacities being met quick, or not being met because of where they're going to, or just country restrictions. And in terms of delays, it's often because of the requirement of tests. For example, an airport close to where I live is currently doing COVID tests to make sure that you don't test positive, and that's causing almost a 4+ hour delay at the airport, causing many to miss their flights too. So we wanted to just sort of talk about why that's been going on, why we have COVID tests, how your airport journey might be looking a little differently if you plan on traveling soon for New Year's. And yes, and Anusha here has recently traveled on an airplane with the height of the Omicron variant. So I'll pass it over to you to share your thoughts.
Yeah, so obviously both of us are out of state for college, so both of us traveled back at the end of the semester, when Omicron was not as like in like the public imagination, like people were hearing about it, but like it wasn't like at the peak and like the height of like what it is now. So I would definitely say that like honestly there is no difference in like the way like aircrafts and like airplanes were like talking about it like initially. Like you'll hear the exact same stuff in the airplanes being like the federal mask mandate is still in place, but it really does feel like people are just over it, this new variant. They are not going to stop for gathering for the holidays. I know that my family was a very similar output, and like we're all very much like, put your mask on, get vaccinated, like, go get your booster shot, do whatever you need to do to protect yourself. But like once all that happened, I think most people are in the same boat where it's kind of like they just want to go. They want to like, go travel, go to the holidays, go spend time with family. I did see a lot of people talking about getting like rapid COVID tests right before they traveled, right before like maybe like going and hanging out with people. And I thought that was a pretty good idea. And I saw a lot of people actually at the airport, like you could see them like crowded or like doing things like in like a bathroom or something like that. And they were like doing the test and they were just waiting to see the result. Don't know how helpful that is considering you're already in a crowded place. But I mean, they're doing what they need to do, right? And if they would have caught it, they would have caught it in that moment, maybe. So I don't know. I think that in regard to the flights themselves, I know Shreyas, I'm sure you saw, I'm sure a lot of people have seen it, flights have been canceled all over the place because of the new variant. And it's actually because the staff and the pilots and like the flight attendants and all of those other like airport employees and specifically the airline employees are getting sick. Um, yeah, I my only thing there is just wear your mask if you can on those airplanes. Like do it because there is a mandate, but don't be like lackadaisical with it. These people are working on Christmas and like the holidays, and they already put up with a lot of crap from travelers. I'm sure everyone's seen the whole report of people being more like boisterous and angry, more violent in some cases with these attendants, and they're just doing their job and they're getting sick for it and they're missing people for it. And so I mean, the airlines really didn't have a choice, did they? Because the whole quarantine period. But Treyas, what do you think?
Yeah, and I was just going to add that in terms of the COVID tests at airports, that's for international travel. at most airports. So if you're traveling domestically, so within the United States, continental or to Hawaii or Alaska, or I believe Alaska is part of continental, but regardless, if you're traveling within the United States, I would recommend doing like an at-home COVID test, or I know some facilities have like rapid tests that you can just go to and wait for maybe like an hour and see a result. I would recommend that. And additionally, yeah, just I think what needs to be said too is, and I know Dr. Fauci was discussing this recently, but we can't be complacent with this variant either, in the sense of oh yeah, well, we've been having variants for a while, and especially with the Delta variant, how it was bad but not as severe as we anticipated. I think we can't just you know be overly optimistic. I think optimistic but cautious is important. I think masking as much as you can, especially if you're traveling somewhere that is densely populated, whether it be your gathering per se, or whether it be traveling physically outside where everyone is right next to each other and things like that. I think just doing your part and being diligent is important. And the nature of data related to the Omicron variant is always changing, but the biggest trend that doctors and other healthcare workers consistently report is that the individuals that are being affected by Omicron the most are those that are unvaccinated. So again, especially if you're traveling in the next few days because of the holidays, stay safe. Please get vaccinated, because Omicron is merciless in that regard.
Yeah, get tested if you can, like do those rapid tests. Like if you're gonna go like, drive to your like, grandparents, like a family holiday gathering, do that rapid test outside the car if you have access to it, and just get those results. It's 15 minutes. It's not that hard. I did it yesterday just so I could go like hang out with my friend on her birthday, because she's 21 and she really, really wants to have a birthday party because she hasn't had one for the past like 2 years now. So go do the tests if you can. And better yet, if you don't need to hang out with people, or like you don't really need to go somewhere, then like maybe just keep it low key, smaller gatherings. Be careful what you do, because at the end of the day, this country isn't fully vaccinated yet. And until we are, and until frankly the world is fully vaccinated, because we are a global world, like, not a global world, but you know what I mean? Like this world is very interconnected. Until everyone's fully vaccinated, there's going to be new mutations and variants coming around. And that means that, well, it doesn't necessarily mean shut down your entire life. That does mean we're going to have to be careful, because it seems like COVID is just going to be something that sticks around for a while. And hopefully it sticks around in a milder form, like maybe like a flu or something like that, or like a cold that we can already deal with. But until we like really reach that point, just be careful, I guess.
Yeah. And because we are a health policy organization, to connect it back to legislation or just government actions, we're most likely going to see mandates like this, or in terms of the mask wearing, or just restrictions on travel until a lot of the world can be vaccinated, till a lot of the country can be vaccinated. And what we're seeing is that worldwide, really, there is vaccine inequity in being able to get access to the vaccines, and a lot of vaccines are being disposed and things like that, while some countries do not even have nearly enough vaccines.
Yeah.
So again, more guidelines and more just government action, guided by the World Health Organization and institutions like that, would be beneficial. And once we see changes there, that's most likely what's going to cause more relaxation in terms of travel in this era we live in. Do you agree?
Yeah, trust me, it's very frustrating now in this country with like the restrictions, and like I'm sure people were like frustrated and like they want to go places, they're scared not to, they're stressed. There's so many things that are going on, but it's important to also remember, like Shreya said, that there is a very significant part of the world that has not even like seen a vaccine yet. Not even gotten that first dose, not even like been able to like commiserate over a second dose, and like the symptoms and like the booster shots are like not even like a possibility in many countries. Until that happens, there is going to be no end to this pandemic. It's not just a United States epidemic, it's a worldwide epidemic. So we have to look out for our politicians and hope that they understand that, and are listening to the scientists who are saying these things, and hopefully they will enact legislation to work together with other international leaders to really bring this to an end.
Agreed. On that note, thank you so much for listening to today's episode, and please continue to stay educated, and we look forward to seeing you for another The Political Patient episode.
Bye.